In this last part of our video, we will talk about some clinical related to the arches of foot. First, one interesting fact about the arches of the foot is that they are not fully formed at birth. In infants, the foot appears flat because the arches have not yet developed. The arches gradually develop over time as the muscles, ligaments, and tendons in the foot strengthen and become more supportive. This process typically continues until the age of 8 to 10 years old. Common conditions related to arches of foot include flat feet, plantar fasciitis, and stress fractures. First, let's talk about flat feet. Absence or collapse of the arches leads to flat feet, which may be congenital or acquired. Here you can see the normal and a flat foot. The effects of a flat foot are as loss of spring in the foot leads to a clumsy, shuffling gait. Loss of shock absorbing function makes the foot more liable to trauma and osteoarthritis. Loss of the concavity of the sole leads to compression of the nerves and vessels of the sole. Forefoot neuralgia is brought on by compression of the medial and lateral plantar nerves' ability to communicate. Vascular abnormalities in the toes could be brought on by blood vessel compression. The second condition that is common due to impaired arches of foot is called plantar fasciitis. In this condition, the plantar aponeurosis is stretched or strained. Plantar fasciitis is a condition that causes pain and inflammation in the heel or arch of the foot. It results from the plantar fascia being strained and overused. The posterior attachment of the aponeurosis becomes ossified as a result of this condition's recurrent attacks, creating a calcaneal spur. The main symptom of plantar fasciitis is pain in the heel or arch of the foot, which is frequently worse in the morning or after prolonged periods of sitting or standing. It is possible to have either sharp or dull pain along with stiffness, swelling, or a burning sensation. Age, obesity, flat feet or high arches, repetitive foot stress activities such as running or leaping, and wearing shoes with inadequate arch support are all risk factors for plantar fasciitis. Rolling a ball with your foot on the ground is a typical exercise suggested to reduce the pain. Rest, ice, and stretching exercises are frequently used to treat plantar fasciitis. Supportive footwear or orthotic inserts are also recommended. To lessen discomfort and inflammation, nonsteroidal anti-inflammatory medicines, NSAIDs, may also be suggested. Lastly, we have the stress fractures of the foot. A stress fracture is a small crack or break in a bone, caused by repetitive stress on the bone over time. They are a common injury, especially among athletes and those who engage in high-impact physical activities. When the arch collapses, more stress is placed on certain parts of the foot, leading to increased pressure on the bones and increased risk of stress fractures. Common symptoms of stress fractures in the foot include pain, swelling, tenderness, and difficulty bearing weight on the affected foot. Treatment for stress fractures typically involves rest, immobilization of the foot, and in some cases, surgery. It's also important to avoid overuse and high-impact activities that can place excessive stress on the bones of the foot. Preventing stress fractures due to collapsed arches involves taking steps to support the arches of the feet, such as wearing supportive footwear, using arch supports or orthotics, and doing exercises recommended by your physical therapist can help the patient to strengthen the muscles that support the arch, hence reducing the risk of fracture. That is all about the arches of foot.
Watch our medical videos anytime and anywhere. Download sqadia.com app now.